Good morning. I'm Laura Rudberg, MassBio's Director of Events. We appreciate you joining us for MassBio's virtual Possible Talks. These are 15 minutes of inspiring and engaging content in the style of a TED Talk. With us today is Udit Batra. He's the CEO of MilliporeSigma, Executive Board, Merck KGaA Darmstadt Germany, and a member of MassBio's Board of Directors. Udit will talk through the journey of a product that has an important place in the COVID-19 fight. Currently, the life sciences businesses of Merck KGaA Darmstadt Germany are working on over 25 testing solutions, 45 different vaccines, and over 20 monoclonal antibody plasma products and antivirals, all with important work ahead. We've reserved a few minutes for Q&A at the end of Udit's presentation. Please use the Q&A box at the bottom of your screen to add your questions. Feel free to add them at any time, no need to wait till the end. You can also upvote any question already in the tab by clicking that thumbs up. With that, I will turn it over to Udit. Udit, go ahead.
Laura, good morning, and thanks to you and to MassBio for the opportunity to share some of our experiences during this unprecedented time of a global pandemic. Let me start by sharing with you the story of proteinase K, which in these days of the COVID-19 pandemic, you can frequently find in a molecular diagnostic kit. ProK, as it's called, is a broad spectrum protease and an enzyme that is used in molecular biology to efficiently isolate native undamaged RNA and DNA before it gets tested. It breaks down proteins and it quickly inactivates other enzymes, which are known as nucleases, to purify this genetic material. This tool, this life science tool, is instrumental in developing an effective diagnostic test for COVID-19. And interestingly, as you see on the slide, the global implications of the manufacturing and distribution of ProK are just as significant as the diagnostic test for which it is used, as you see on this slide. While the enzyme originates from a fungus, ProK is a product of a truly global supply chain. The raw material for this product undergoes fermentation and extraction before freeze drying it into a powder state at our sites in Darmstadt, Germany, and Jerusalem in Israel. Some of that final material remains in Germany and in Israel for packaging, while the rest of it is shipped back to Temecula in California and to St. Louis, Missouri for packaging into the final product. From there, ProK is distributed globally from Temecula and Schnelldorf in Germany, which is where our distribution center is. ProK features raw materials and finished products that make multiple crossings across international borders on 3 different continents before reaching the labs where the clinical testing occurs. We rely on the ability to share information and move product absolutely seamlessly across national borders. And I believe that our strength in fighting this pandemic truly depends on our open and rapid collaboration as a global family. Moving on to the next slide. Look, I started with the story because I believe it helps frame the kind of challenges we're facing as an industry together. For context of many of you who are part of MassBio, you might already know MilliporeSigma is the life science tools business of Merck KGaA of Darmstadt, Germany, a 70% family-owned company with 3 different businesses. Of those businesses, MilliporeSigma is the largest, around $8 billion in sales, and we have about 22,000 of us globally. Our role in the chemical industry amounts to 352 years. You heard it right, 352 years of continuous operation dating back to 1688. The Merck family acquired Millipore Corporation as a life science tools business back in 2010. In 2014, I had the privilege to take over as CEO, and a few months later, we announced the acquisition of the specialty and technology company called Sigma Aldrich, hence the name MilliporeSigma as the business is known. Today, we operate in over 55 manufacturing sites across UK, US, Germany, China, India, and many parts of Latin America. We manufacture and supply tools, as Laura mentioned at the beginning, that fulfill R&D work for vaccines, for diagnostic tests, and potential therapeutics in fighting this pandemic. So our role in public health for this particular crisis is truly undeniable. And so I will explore 3 topics with you today. First, I'll talk about our response to the pandemic, and I'll share with you how we are dealing with it. Second, how we are directing our innovation efforts to solve problems related to this pandemic. And finally, I will end with some personal reflections. So let me start with our response. I've come to believe in the face of any such crisis or transformation, adherence to a simple three-step process provides a valuable structure and clarity that is necessary for successful resolution. First, one must identify and agree on clear priorities. Second, we must establish a common understanding of the situation. And thirdly, we must have an execution process that is transparent and well choreographed. So let me start with these priorities. What are they? With China as home to over a thousand of our colleagues and some of our largest manufacturing and distribution investments in the recent years, it also happens to be our fastest growing subsidiary. We determined as early as January that this outbreak of COVID-19 had the potential of escalating into a global pandemic. And at that point, three priorities emerged, and they're rather obvious. Number one, to ensure the safety and well-being of our employees. Number two, to play a positive role in public health and make sure our commitments are fulfilled. And finally, to sustain our business well beyond the crisis. The pandemic's early move into Europe really tested these priorities when on February 26th, that's roughly 2 months ago, we learned that an employee's spouse had tested positive for COVID-19. And with no confirmation that the employee might be infected, we immediately decided to close the building in which employees worked, asked all employees to work from home from that building, and traced those with whom the individual had made contact in other buildings on the campus. Effectively closing a manufacturing site was a precedent-setting event. But with employee safety as a top priority, as I mentioned, there was but a singular right answer to this scenario, and one that has helped us in good stead down the line. We scrubbed and disinfected the site. We shuttered the building while maintaining open lines of communications with all our employees. Upon reopening, we had implemented clear social distancing rules, an extra hour between different shifts to prevent overlap, a clear delineation of traffic only going in one particular direction to minimize unnecessary contact, and the division of teams into individual and separate functioning shifts. With some of the key components, as I mentioned earlier, some of the key components for diagnostic kits made at this particular site in France, a safe reopening was essential. And remember, I said our second priority is to be in service of public health. So it was really essential that we were able to open this site and provide a safe working environment for our colleagues. And with success, that process has been repeated proactively in many different sites. Let me move on now to the second step of effectively addressing the challenge of crisis and transformation. And this is the common understanding of any situation. To do so on a day-to-day basis, we meet virtually 3 times a week for 1 hour with a COVID-19 executive team. Twice a week, it's a broader group of roughly 30 colleagues, and once a week, it's purely my leadership team and myself. And then twice a week, the other 2 days, I meet with our executive board out of Germany, and that too to discuss and debate and decide on what we need to do for this pandemic. This is all done to establish a common understanding of the situation and design a transparent plan for execution. And in this COVID-19 executive meeting, we really ask ourselves 4 basic questions. The first one, and this is to establish the common understanding of the situation: what is the current state of the pandemic from an epidemiological perspective, and what is the public health response globally? I believe, and I'm sure you are as well, inundated by information, some of which is reliable, and a lot of it is unreliable regarding the spread and effectiveness of interventions that are readily available. And thus, we must establish this one source of truth. And so very early on, a few like-minded colleagues and I decided to form a journal club. We read papers, primary papers, we scour through the virtual universe and share information regularly with each other so we can have a common understanding of the spread of the disease, the development of treatments, vaccines, and diagnostics to figure out how to prioritize our efforts internally as well. The second question then we ask ourselves, going back to the basic principles, is how are our employees faring in the hotspots? We review the key sites, the number of possible cases, and the mitigation plans that are not dissimilar to what I mentioned to you earlier, so I won't elaborate on those any further. Third, we ask ourselves, what is the status of our products that are needed for key diagnostics, treatments, and vaccines, consistent with the second principle I mentioned, our role in the public health crisis. And here we offer products for which the demand has risen dramatically, and in some cases well beyond our ability to supply in the short term, even if we had 100% productivity. We are, for example, one of the leading suppliers of what are called single-use assemblies for biologics processing. We are increasing capacity by examining ways to commission new clean room to assemble these products, to train new staff, and to procure new raw materials. So that's just an example of how we are responding by increasing capacity. In that process, we've had great cooperation from the Massachusetts Governor's Office and many government officials across the country. And every individual, especially those in the government offices, have been super helpful, and they truly understand the value of the products that we're providing in this crisis. And the last question we ask ourselves is, how do we sustain our business well beyond this pandemic? How is the supply chain performing? What is the financial health of the business during this time? What is the cash flow? The two supply chain metrics that I find super helpful during this crisis is the number of orders that are shipped out of our warehouses, and we track that number daily, globally across 100 distribution centers. And second, what is the cadence of order placement for our products coming up? So the order shipment gave us a very interesting signal very early on in the pandemic. We saw it drop almost to zero right around the Chinese New Year in China, and then about 6 to 8 weeks later, it started to pick up. Second, on the order placement, I see it as a leading indicator. We see, especially in academic labs, the order placement has gone down, but it started to now pick up as more and more people are coming back, especially in China. And this kind of insight really reveals also another aspect of the pandemic. How do we allocate scarce product? And there we've established very clear rules on products that are needed for the COVID pandemic to receive the highest priority, then life-saving drugs, and then other contractual obligations. And the last step in managing such a crisis is the execution of a transparent, well-choreographed plan. And our approach in this case included galvanizing our global R&D organization, and I'm super happy about what the team was able to accomplish in such a short period of time. We have something called the Innovation Board, where the top R&D leaders, including in this case for this particular workshop, 30 additional biologists, chemists, engineers, data scientists all got together and said, what can we do in order to make sure that we accelerate solutions to resolve the COVID-19 pandemic and mitigate any collateral impact in the future. And in doing so, as you see on the slide, there were about 100 ideas that ranged across 7 different categories, and you see them on the slide. I won't repeat all of them, but you can see they go from faster point of care testing, air quality sampling, and even public transportation. We have products that we use in clean rooms that could be repurposed for that, CRISPR library screens for newer therapies, and of course, manufacturing technologies for rapidly scaling up vaccines and treatments. And there are many others. Stay tuned. We will be reaching out for collaborators where we don't have capabilities internally to make sure that these ideas move fast, rapidly. Let me now conclude with some personal reflections. I find during this time, reading primary literature, debating it with others who have the same source of valuable and reliable data and insight, really helpful. Additionally, I find preserving time to reflect, to run, to meditate, and to spend time with family essential in these long days. And in these windows of time where I'm reflecting, I can think through what information and insights that we've gathered from our journal club, from my team, and from customers and our stakeholders are valuable in the longer term. And I hope, and this is part of the reason why I'm doing this webinar, that armed with these insights, we can document what we believe can ensure the establishment of a common, trusted, and rapid understanding of the spread of disease, its impact, and the infrastructural supports that can help us provide help us avoid the scarcity of basics like hospital beds, masks, and in our case, capacity to manufacture raw materials. Doing so really allows me to lastly consider possibilities of nurturing the innovations that address this challenge of our time. To come full circle from where I started, I remain deeply, deeply convinced that close work as a global family will yield advancements in meeting the challenges posed by this pandemic. Our global need is urgent, and open science with rigor and trusted data is the path to success. We will do all we can to end this pandemic and work towards preventing others in the future. And I hope many of you will join us as you deem possible. After all, it takes only a fungal enzyme like proteinase K to remind us the impact of a global interaction and how it has an impact on our health and prosperity. Thank you very much for listening. And with that, Laura, I'm happy to take any questions.
Thank you, Udit. That was really insightful. I didn't have a great understanding of how much is involved with the supply chain. It just must be a huge undertaking. We do have 3 questions already, and we have about 10 minutes for questions, so keep them coming. Bob Coughlin, our very own Bob Coughlin, has asked, when you are talking to leaders here in Massachusetts and globally, what do you think are the top areas where we need to come together to tackle this public health challenge? And he thanks you for speaking this morning.
Thank you very much, and thanks for the question, Bob. Good morning. I think you can break it up into 3 parts, and they're based along the time scale. So what do we do immediately? How do we make sure that we can have essential services running, be it our healthcare facilities, be it essential employers and essential producers like our company and many others who are developing therapeutics, vaccines, and diagnostics. This is on everyone's mind in the short term. Included in that is ensuring the safety of our families and ensuring the safety of our employees. I think that's first and foremost the most important thing in the short term. Second, we spend a lot of time discussing how do we make sure, first, how do we understand, can we develop a common understanding of how this pandemic is going to progress and what are the phases? And there is some sort of convergence in that, at least around Massachusetts, the leaders in Massachusetts. In the short term, we still think social distancing is required. But as we bring more and more people, try to bring more and more people back to work, we need to make sure our healthcare facilities are prepared, the diagnostics are available to track and trace, and then eventually as the treatments and vaccines come, the burden on healthcare facilities will go down. But we are deeply engaged in the second phase of articulating what this coming back to work will look like. And the third is engaging with public officials to make our point of view known. And making sure that we all come back as a community. And there's a lot of discussion and debate. And I must say, I am absolutely amazed at how well we've come together. We have abandoned competitive sort of boundaries within reason, of course, and come to some common understanding. So I hope that gives you some insight.
Thank you for that. Second question, has the pandemic demands resulted in more cross-industry collaboration, which you literally just touched on a second ago? And what if there is a great increase in demand, if a really good test or vaccine or cure are created? How are we going to manage that increase in demand?
It's a great question. Firstly, the collaboration is immense, right? And also including with academic institutions. We collaborate with the Jenner Institute in Oxford and many other academic institutions who develop vaccines. We've been working with them for several years to develop platforms for manufacturing, and now that's helping us quite a bit. In terms of how I see it going forward as the demand increases, I think you need to break the problem down into 2 parts. First, on the demand side, we need to be clear about the forecasting of what is needed by when. It's not, and we are very cautious and very thoughtful about how the supply is allocated, and there the demand forecast has to be very precise and very thoughtful, so that nobody's getting more supply than they really need, and it becomes a just-in-time sort of process. And second, where we see a supply pinch, we are basically looking at expansion. I mean, this is relevant for our site in Danvers, Massachusetts, where we produce assemblies for making vaccines and treatments, and this particular site was already under pressure in terms of demand for a while before the pandemic hit. And now as the pandemic hit, that's come under a lot of pressure. So we were looking for additional space, additional clean room space, training our colleagues, training additional colleagues to be able to enter that space. And on that front, we've received really, really good help from Governor Baker's administration and all the government officials just to try and find space and make sure that we're ready to go as and when needed. Laura, I can't hear you. I think you're on mute.
Sorry. Thank you for that answer. You and I touched on this a little bit quickly before we broadcast, but we have a question. How do you think this pandemic will affect manufacturing and the future of work in the long term? So you had said you feel like people are already getting more comfortable, like you and I being on this video this morning, but any other insights on that?
I think let's take the short term first, right? In the short term, for sure, we expect this modus operandi to go on, let's say, from anywhere between 6 and 18 months, right? So we've de-densified our sites. Fewer people are at every site, maybe 80% of what used to be the case. We're implementing testing at the different places. We have good PPE. So that is a modus operandi for, let's say, for the near future. Then in the long term, just taking the example of the site I mentioned earlier, we will look to ensure that automation is implemented across our sites much more, right? I think in the long term, the solution can't be that the productivity is down or the number of people at sites are down, but the productivity is also down. So you have to find ways of increasing the productivity to historic levels or even higher, but having fewer people engaged in some of those facilities. I think that's something that we are already seeing. I mean, we basically challenged our teams to say, okay, with the new working environment, how do you ensure your productivity is higher? And that creates a lot of different ideas. And I think on the manufacturing side, it's about automation. It's about doing better demand forecasting. It's about doing better supply forecasting. It's about integrating the supply chain in a global network. So I think these are irreversible trends. Now, don't get me wrong. These technologies existed already. We already had this data. It just the fact that the pandemic came and there is such a need for all of us to now use this, otherwise we can't function. By the time it's done, it will be second nature, and the productivity improvement will be quite dramatic in my view, in our ability to use the data, in our ability to reduce inventory where it's needed. So I expect quite a bit of positive impact in the implementation of especially digital technology, not just for communication, but also for analysis.
Yep. I feel like this period of time is making everybody think differently and approach their work differently. And it's sort of invigorating to a certain extent. You know, we're stuck home, we don't get to be with each other, but we're getting to learn new things, and it makes you kind of excited.
Speak for yourself. I get a lot of energy by meeting my colleagues, and there's a withdrawal symptom. The withdrawal symptoms are there. I mean, I wish I could reach in through and get into the manufacturing sites. In fact, I discussed with our head of supply chain to go to our Danvers site, to go to our Jaffrey site, and he forbid me. And I said, what if I drive in my car and I just sit outside the site? He said, what are you going to accomplish? They're still not going to let you in. So no, I miss it.
Oh, yeah, I miss my colleagues very much. We do a team Zoom, and it's nice to see everybody. So we have two more questions, and I think we have just enough time for them. Jerry asks, how did you come up with the idea of doing a journal club? And what insights do you get, and how are your teams participating, and what are you learning from the journal club?
Look, I'm a scientist at heart. I have a PhD, and I was forced to be in journal clubs during my PhD. And I think in these days, it's partly out of necessity. There is so much information available. And I mean, you can follow this on the networks, right? I mean, some expert comes and talks, and then there are 3 hours of people interpreting what the person has said. So you have more interpreters than primary information. But I want the primary information, and let me be the judge of how useful it is. And in order to dig that primary information, either you have to be tuned into these things all the time, or you have to know the primary source. And I don't feel I have the expertise to understand all of it. So we have like-minded colleagues. There are 4 of us, one with a data science and MD background, another with a microbiology background, another with a vaccine background who's an engineer. We basically read the same papers or different papers, come together and discuss and debate. And so it's grown organically. And I guard that time religiously. We call it public health discussion. Others have tried to come in, but if they don't read papers and they don't contribute, we kick them out. So sorry about that. But it's super helpful because it helps us get primary information interpreted. For instance, what is the level of asymptomatic transmission? It's a primary piece of information. And there are thoughtful studies that have been run in different communities. How do you mine that and bring it into your decision making?
So we have a follow-up question to that, and this will be our last question. Thank you for speaking with us today. This is from John Walker. Many of us are looking for truth in this pandemic, and we don't have the knowledge or the bandwidth to determine what that truth is for ourselves. Do you make public the information that comes out of your journal club and participating scientists determined to be relevant and factual about the current situation?
I mean, it would be too arrogant to say we are the only ones who are interpreting this information. There are people who have much more depth and much more understanding, and some of them have written, and I think you can look at their credentials. In fact, last week itself, we had a whole set of business leaders, scientific folks as well, interpreting what is going on. We, in such webinars, in such forums, we're basically making public what we are learning. It would be too much for me to summarize our journal club every 3 times a week that we meet. But happy to answer questions if others say, hey, you know what, I would love to, I have read this. If you want to join the journal club, you have to work too. So you have to read something, you have to bring something to the table, and you can, in some cases, join our discussion. I have to be cautious on how open I make it. But if people are interested, we are happy to share. And in that informal way. I don't see us having the time to write a summary after every discussion.
Right.
Sorry to disappoint. But it's one of the sources of energy for me, for sure.
Yeah, it sounds like you get a lot out of it, which is great.
Indeed, indeed.
So that is about the end of our time. Let me just make sure nobody else asks questions. Nope, we're good. Udit, thank you so much for taking the time this morning. We were really happy to hear about supply chain and everything that you're doing at MilliporeSigma and Merck. I'm going to get it wrong. Merck KGaA Darmstadt Germany.
You got it. You got it. Thank you very much. Look, Laura, thank you. And thanks to Bob and MassBio for the opportunity to share our experience. It's a privilege in such a pivotal moment in the history of science and our lives. I'm really deeply impressed with our public health workers, and I'm equally impressed with my colleagues, especially in our manufacturing and distribution sites. Despite the fact that I'm not able to go in and touch and see them, I have incredible pride in what they're doing. So really, thank you very much for listening to our story.
Thanks so much. And we'll have this posted on YouTube in the next few days, and MilliporeSigma will have it on their networks as well.
Thank you very much.
Have a great Friday, everyone.
Thank you. Bye-bye, everyone.